So I am Jen Rose Fitzgerald. I use she, they pronouns, and I am the program coordinator for the Data for Social Impact Initiative. And the purpose of this initiative is to build capacity and connection among social sector organizations who want to utilize data to increase their impact and promote more equitable outcomes. So that is a mouthful, but we want to provide spaces for folks to connect and just think about how to grapple with how can we collectively use data better for good, in essence. And one such space is a new thing that we are calling data deep dives. And the purpose of this series is really to promote some dialogue around innovative data collaboration efforts in the St. Louis region. So today we're going to hear about some data collaboration efforts that are taking place through the Center for Applied Research and Engagement Systems, or CARES, which you will hear more about at the University of Missouri. And our agenda today, we will introduce the speakers. They will present on their work and pose some questions to you about some of the challenges and benefits of data sharing. You'll have a chance to do a little Q&A with them. And then we'll have some time at the end to really think about data collaboration more broadly and some of the challenges and opportunities that you see in your own work. So we will get to that in just a moment. Really quickly, before we do that, I do want to do a shameless plug for our survey. I'm going to drop a link in the chat where if you click on this and just have it open in your browser so that after the event, it's easy for you to fill out. I know as data people, you understand these surveys can really be helpful in shaping our program, and we would just love to hear your thoughts on how we can best shape future events. So let me drop that in the chat really quickly. Pardon the technical difficulties here. There we go. And finally, speaking of future events, we have an event coming up. Am I back?
Yes, you're back. Okay, great.
All right, excellent. Apologies, let me just say this again. The next event that we have coming up on September 7th is an in-person event, looking back, looking forward, what's next for the St. Louis data community. And this will be in Clark Fox Forum at Hillman Hall. And we would just love for you to join us in celebrating the 5th birthday of the Regional Data Alliance and the next phase for Data for Social Impact. So I will drop that link in the chat in just a moment. But in the meantime, I want to pass the baton to Sarah Mohammed, who will go ahead and get us into the event. So Sarah.
Awesome. Hello, everyone. My name is Sarah Mohammed. I am the Equity and Engagement Lead with the Regional Data Alliance. We work closely with DSI on a number of initiatives, including these data deep dives. So I will be introducing the speakers in just a moment, but we first wanted to start with this poll that the speakers were interested in seeing the results about, just to kind of understand who's in the room and what your experience has been. So this poll will show up on your screen as a Zoom poll, but I'll just read it out for now. So regarding local data and data sharing, please select the option that best describe your organization's current status. And the A is our organization is actively collecting data and sharing it. B, our organization is collecting data, but has not started sharing it. C, our organization would like to collect data. And D, not applicable or not sure. Okay, so it looks like we have responses coming in. Oh, I love that I get to see this. I'm not usually on the other end of this, so this is fun. So we have about 76% respondents currently. I'll give it just another minute. So cool, we're at like 80%. That's pretty good. So it looks like we have a lot of people who are actively collecting data and sharing it. But we have some respondents who would like to move more towards that, or who, oh, there, you should be able to see the responses in a minute, I think. Yeah, so it looks like we're working towards that, so that's great. That's something that we're going to be talking about today, and that our speakers will be addressing. So I'm going to go ahead and stop sharing this now. Great. So thanks for participating in that. So, you know, as someone who has worked in public health, I used to work at a local health department. This is a topic that's particularly interesting to me, but I also understand the difficulties and challenges of doing this type of work, collaborating on sharing data, the barriers that that come with that. And if you do this type of work, we would love for you to be thinking about that in the background, because we will be having some discussion after the speakers do their presentation, and we would love to hear from you. So I'm going to go ahead and introduce our speakers. So you can see their awesome headshots here on the slide. So first we have Jamie Kleinzorgi, who is the Assistant Director and Senior Project Coordinator for the Center for Applied Research and Engagement Systems, also known as CARES, at the University of Missouri. So Jamie has trained thousands of organizations, community professionals, government agencies, and healthcare systems on the use and application of data and GIS for community assessment, programming, and evaluation. Jamie is also a doctoral student in sociology, focusing on how communities produce, use, share, and govern data. And we also have Angela Johnson with us, who is the Assistant Director and Lead Project Analyst at the Center for Applied Research and Engagement Systems. Angela works with organizations to help them with their data needs and goals. And whether it's project consulting or planning, conducting data acquisition and analysis, or creating visuals and tools, Angela enjoys supporting different groups in their ability to do more things with data. So without further ado, I will go ahead and turn it over to Jamie. I think is starting first. Yep. So Jamie.
Yeah, thank you so much for that wonderful introduction. We really appreciate the opportunity to be with you all today and share some of the work that we're doing and share about some of the projects that we're working on. So as was mentioned, feel free, you know, we would love for this to be an interactive sort of discussion. So if you have questions as we go, you can drop those in the chat, but we will also have time at the end to address some of those. So as mentioned, me and Angela are going to be kind of sharing the presentation for today, some of the learning objectives that we have for today. We just really hope that everybody has a good understanding of sort of the evolution of our broadband work that we're doing. There's a pretty significant data piece involved in that. And then we're also going to take a tour of our local public health dashboards. So that'll be another piece. And then, as I mentioned, just really engaging in some discussion around local data sharing and what that looks like and what that means for all of us. So can you guys still see my screen? Okay, good. Okay. So really quickly, just wanted to tell you guys who is CARES. So if you have never heard of us before, we do have a very long name, the Center for Applied Research and Engagement Systems, but we go by CARES. We've been part of the University of Missouri for 31 years now, doing mapping and data visualization work. We're most well known for needs assessments. We have a variety of map rooms in the Missouri Map Room that's available publicly. And then we also provide custom data solutions to organizations all across the country. So we're not just limited to Missouri, and we're not just limited to the university. These are some of the projects and partners that we have across the country. So just give you an idea of the types of groups that we work with. And most of these folks, like I said, are either engaged in some sort of needs assessment, some sort of data analysis or dashboarding kind of work. And so that's what we're working on with those folks. So today we're going to focus on two primary projects. One is around broadband and the other one is around reportable diseases. So I'm going to kick us off with our broadband project and wanted to start just with a little bit of context before we dive into the data piece. And so a lot of people ask, why is the University of Missouri involved in broadband? Well, there's a variety of reasons. And back in 2019, the UM system and the University of Missouri Extension decided that broadband was really something that they wanted to invest in and get involved in the state for four major reasons. So we have these four grand challenges. The first one is around economic growth. We recognized, especially because of COVID and just the way that the world is moving, that in order to have good workforce development, in order to attract population and keep folks and really spur some economic growth, broadband is absolutely necessary. Strong broadband is absolutely necessary. So that was really one of the reasons. Educational excellence, making sure that our public schools and other folks have connections to learning opportunities, whether that be through the university or just through other places. We also wanted to make sure that we were supporting healthy futures. And so a good example of this is the MRI machine at the University of Missouri is one of the biggest, most powerful MRI machines, but it takes a lot of broadband connectivity and bandwidth in order to send those MRIs anywhere. And so even though you might be able to have that done in Columbia, if your local public health department or your local hospital can't receive the data, that's a problem, right? And so making sure that we are focused on healthy futures. And then really around precision agriculture. Obviously, MU Extension has a strong tie to agriculture, and just knowing that more and more agriculture does rely on access to broadband in order to run machinery, make sure that you're up to date on crop prices and those types of things. So all of those reasons were part of why the University of Missouri decided to get involved. Some other reasons that are more related to some of the data and the community process work include the fact that early on, we all recognized that there was a problem with the data that came to us from the FCC, or the Federal Communications Commission. And that was really something that we felt like with more local data collection, we could start to combat or overcome. At that time, early on, the FCC had not yet provided guidance on a challenge process. So if you wanted to challenge what the internet service providers were saying about your connectivity in your area, that process hadn't really been in place yet. And so we wanted to get at the forefront of that to make sure that we could help people all across the state engage in that process. We also committed to putting together and have put together a digitally connected communities guide that really embedded the broadband work with community development and community engagement. And there's another strong data collection piece that's involved in that. At the time, communities needed, and they still need, data to inform conversations locally with broadband partners and just with folks and funders all across the state. We recognized early on that physical assets vary by community, and the physical asset data collection was going to be really important to making sure that all parts of our state got connected and got the funding they needed. And then we found out, and which is still mostly true, the internet service providers weren't going to share their data. And so if we wanted data about local connectivity and what people were actually experiencing in communities, we were going to have to get it ourselves. And so that led us into some opportunities. So as I mentioned, that first opportunity was really around dispelling some of the FCC data and figuring out what was really happening on the ground in people's homes and how folks were connecting. So what you can see here on the left-hand side is the FCC data is in purple. Those areas that are in darkest purple are considered 100% covered. Like everybody should have access to internet, and it should be, you know, mostly affordable. And what you see there on the right then is the American Community Survey self-reported data of households with broadband. And so as you can see, there's some misalignment or incongruency between the two. The FCC data was really over-reporting the connectivity and the availability of broadband across the state. And we were able to look at some of the ACS data and other locally collected data to start to paint a real picture, a better picture of what conditions were actually like in the community. And so that's really one of the first opportunities we took to collect some data and to start digging into data issues around broadband. The second opportunity was more related to funding. So once the FCC started to put out more guidance, we recognized that having local data and having a good understanding, again, of that FCC data versus self-reported data was going to be critical to applying for and receiving funds from a variety of different federal and state level organizations. And so what you can see here is this map kind of shows you some of the different funding opportunities that have come over the last 3 or so years. And all of these areas that have been funded, they had to submit data in order to do those funding applications. They had to know what connectivity looked like in their communities. Again, a lot of the funding organizations were relying on that FCC data. And had we continued to rely only on that FCC data, there would be areas that definitely aren't 100% covered, still being reported as 100% covered, which rules you out or excludes you from many of these funding opportunities. And so we really needed to make sure that people had access to good quality data that actually told a better story, right, than the FCC data. And because there were all of these funding opportunities that were coming down the pipe. So that was really the second thing that we wanted to look at. And we also wanted to see here, by collecting these data of like where things are being funded, what areas are being funded, where those gaps were, right? So where are there gaps in service versus where are things that are being funded? Are those things aligning? And what are some of the areas that maybe have the greatest vulnerabilities when it comes to getting and receiving broadband funding, and then also broadband expansion. The next opportunity that we had related to data was really around collecting speed tests. And so we got lucky early on in the initiative to start working in Ballinger County. It is a rural, small, declining population type of county. At the time, 4 out of 5 residents had no high-speed internet. There's a nice video here that you can watch that has some community members, talking about their experiences in their community not being able to access internet and what that does to critical services like their public health department and other types of services that are available. There was little to no interest from the internet service providers in that area to expand, to continue to provide more bandwidth or greater bandwidth across that county. And so they formed a community-led coalition to start to address that issue. And again, we really needed data to show that they didn't have internet, that 4 out of 5 residents had no high-speed internet, and that there was very little connectivity across the area. So what we started to do, I will go here, was we put together a household survey and we started doing speed tests. So if you go to mobroadband.org, you can take this same speed test and see your little dot show up on the map. But what this really did was it allowed for us in real time, as the community process was going on and as community members were engaging with the broadband development, to also do data collection at the same time, which worked out in a lot of counties' favors, right? To really have that momentum around the coalition development and then also the data collection. So what you can see here is we set up just a simple speed test. We actually used the Ookla, which is a very well-known speed test system, to be able to track the upload and download speeds, ping and jitter, those types of things. And then we did collect a little bit more information from folks through that household survey, asking them if they knew what kind of broadband they had, what kind of internet. So is it DSL? Is it fiber? Is it wired? Is it not wired? Not everybody knows the answer to that question, but nonetheless, we wanted to try to get as much information as we could about what was available. We did also ask about cost, and I'll talk a little bit more about this at the end, but understanding broadband costs across the state has been a big challenge because of the way that internet is bundled most of the time with other types of services like telephone and TV. And so really being able to discern what the actual cost for broadband is oftentimes hard for some of those households. But nonetheless, we wanted to get a general sense, right, of what people were paying for what speeds they were getting. And then we also had the opportunity to have people not take a speed test and just click a box that says there is no internet service at this location, which allowed us then to see where there was or where people were reporting no internet service at all, which is super important as well. So we wanted to see high speeds, low speeds, and no speeds. And so we had several communities go through this digitally connected communities guide, like Bollinger County and others. And you can see that represented here on this map as well, that they were able to get, upwards of, some groups had 600 or more from their county in terms of the number of speed tests that came in. Overall, I think we're up to, 4,000 or 5,000 maybe across the state that we've collected. And this has been really helpful, again, to either confirm or deny the FCC data, and to be able to have something to bring to internet service providers, to local government, and to funders to say, we've done a little bit of work already to survey the area, to survey people, to get an interest of need and then what's available, and help them really make decisions on how to move forward. So this household survey and speed test was somewhat challenging in some ways. As I mentioned, it was typically combined with that community engagement process. So a couple of strategies that we used in order to gather this local data included lots of QR codes. Basically everywhere we could stick a QR code, the communities did that on flyers and in other places. So that was really helpful as a quick way that folks could take that survey. We also utilize social media. One of the communities that we worked with was able to partner with their local government and get a QR code put on the utility and the tax assessment bills. And so trying to hit as many people as possible to get them to take that speed test was really important. And that was a great strategy that got a lot of responses. They had in-person meetings for their coalition and then just for general awareness and information. They utilized newspaper and radio ads. Libraries were a very big support and help because a lot of people who go to the library, they don't have internet at home, right? And so the libraries did provide a place for those people to click that box that said, I have no internet at home, and submit their data. So that was very helpful. Other organizations went to county fairs and used public Wi-Fi hotspots to pop up a message to take the survey before you connected to a public Wi-Fi hotspot. So there was a lot of different ways that the communities went about trying to get the word out about the speed test and to collect a lot of that local data. So you can see here kind of how the distribution looked across Bollinger County. There was quite a few that we saw did have internet. There's quite a few that we see that don't have any internet at all. And again, that was very powerful in helping folks determine and make decisions. The last opportunity that I'll talk about was just this was more of a research data collection opportunity, but nonetheless, it was very helpful in, again, better understanding how communities can plan for and react to this broadband expansion that's happening. So they did a survey of assets, both physical and social. So there was a survey that went out to residents in Turney, Missouri, which is also a small community. They went to Turney and did a physical asset collection. This was really about connecting households to this intelligent router and testing it out. But they were also able to collect adoption and affordability data from the residents who participated in the intelligent router research. And so some of the things in terms of the results that were associated with this study was that the internet intervention was associated with increased in quality of life from the ability to use multiple devices at once. And so, as we know, if you got more than one person living in a house and someone's got to work and someone's got to do school, it is really important to be able to have multiple devices using one connection at one time. And so that was an interesting piece of data that came out of that. So if you are interested, as I mentioned, you can go to mobroadband.org and see all of these things that I've been talking about there on the site. We also have a broadband needs assessment available that's available for every county. We have a planning story map. So if you're interested in planning and thinking about what are some of the physical assets and other types of infrastructure you're going to need to look at, that's available. And then we also have a lot of other data. So since the inception of this project, a lot more data has become available. The FCC has really ramped up their data collection, and now they have what's called fabric data, which is point-specific, location-specific data that is aggregated up to the census tract and block group level, so you can look at that. It is better than that first iteration that we saw early on, so that's good that a lot of what was going on in communities was also forcing the FCC to recognize some of the pitfalls that they had and make some changes. There's also data around the Affordable Connectivity Program, which is an income-based program that helps people get connected that may not be able to afford it. We've created a couple of other specialized tools, included the Cost Burden Index and the Footprint Planning tool, so those are available as well. But wanted to talk about some of the data challenges throughout this process that we have experienced. So first and foremost, we recognized that outside of sort of that incongruency problem with data, that there were no comprehensive records of current utilities, rights of way, easements. And those are really important when you're trying to talk to either an internet service provider, a co-op, or somebody who would maybe potentially be a broadband provider in your area. And so that is an opportunity for sure and it was a challenge for many communities to be able to go out and collect those physical assets. Affordability, as I mentioned, was another big challenge. It was very hard to discern and to separate what people were paying for internet from the bundles that they were, that they were engaged with. And so that is something that we're still trying to overcome in terms of how do we measure affordability because it does vary so much and because of those bundles. The other thing, one of the other challenges that we've experienced is just technical expertise. There's so many folks at the community level, the county commission level, other folks that are in decision-making roles that just don't know enough about broadband to feel comfortable making decisions about the future of their communities. There's a lot of money. It could be very impactful as we think about those 4 grand challenges: education, economy, those types of things. And that made folks really nervous. And so getting them data that helped them make those decisions, we felt was going to be, and we know that it's been really, really critical. There's been a lot of tight timelines for the FCC challenges. So if you want to challenge any of the FCC data, you got to know exactly when that challenge process starts. And you got to be really ready to go, which means you have to have your data already ready to go. So that's been a challenge. The awareness around funding opportunities, just because there are so many right now, which is great, lots of money coming down, but it's hard to keep up with. And then really working with the internet service providers around affordability and adoption. As I mentioned, they are not interested in sharing their data. It makes it harder for us to make the case around what is affordable and where they need to spend more of their time or expand some of their network. So those were some challenges. Some of the opportunities that are still available, though, the unprecedented funding, as we talked about, there's a lot more funding that is still available for broadband expansion. Just last week, Missouri got $1.7 billion for broadband expansion, and that's going to go out to communities and out to internet service providers. And it's going to be allocated based on data, right? Based on population numbers, based on need, based on affordability data. And so that's going to be really important for making those cases, filling out those applications, all of those kinds of things, and then really helping define the implementation plans as well. There are a lot of public-private partnerships or P3 strategies out there that have been super helpful and are definite opportunities for making sure that those technical expertise folks are in the room with the decision makers and everybody's sort of on the same page as folks are moving forward. So that's been great. Identifying populations for data literacy and outreach. So that's something else that's really been uncovered during this project, is that data literacy is low or variable across populations. And so there's a lot of opportunity for that. And then finally, really identifying those populations that would be able to participate in the Affordable Connectivity Program, which again is that low income program that's available to folks across the state to access and to get broadband. So those are some of the opportunities that we have discovered as we've gone through this process. So I wanted to pose a question to you guys. I'm going to switch over to Angela, and she's going to talk some about the public health dashboards. But before we get into that, thinking about broadband as one type of local service, what other types of local data should we be leveraging to uncover or close gaps in service across our community? So if you want to think about this and put some thoughts in the chat, I think that would be great. Broadband is just one example of a way that we are making an impact in big communities and small, with data, making sure that they've got what they need in order to not only get money, but make the right decisions. And so just curious if folks have thoughts on other types of projects or maybe emerging issues that could be impacted similarly with local data.
And just really quickly, Jamie, while people are thinking about that, to put in the chat, someone has posed the question, how will you assess data literacy, and or how did you assess it at a high level to determine it required an intervention? Good question, Angela.
Yeah, that's a great question. So one of the ways that the system and others are working to assess data literacy is really through our digital ambassadors. And so these digital ambassadors are folks that are rooted in community, that are there as folks that can help with technical issues, but also just answer general questions. And so based on the feedback and the types of questions and the types of technical service requests that those digital ambassadors have received, we've seen that there's an issue with that data literacy, internet literacy, I guess maybe be a better term there, and that there is need out there for that. And so I think over time, we'll be able to see the impact of those digital ambassadors, especially as that program continues to ramp up and more people are provided service and help for that. Awesome. Well, you guys can continue to
Yes.
think about, oh, sorry, go ahead.
I'm sorry, I just wanted to point to one more question in the chat, but we'll get to these at the end of the presentation. There will be a Q&A as well. But that one comment said, in terms of healthcare systems, maybe this could fill in the gap created by the current trend of closings of rural healthcare providers.
Yeah, absolutely. So feel free to continue to answer this question in the chat, but I'm going to turn it over to Angela to talk a little bit about our reportable disease dashboards, which is just another project that we're working on.
Yeah, thank you so much. Thank you, Jamie, for that great presentation. I learned a lot as well, so that was fantastic. So we're going to totally shift gears and talk about another project that CARES is involved in, and this is our work with working with local data in our collaborations with some public health departments across the state of Missouri. Next slide. So what we're talking about when we're talking about reportable diseases is we're talking about public health surveillance. Being that this is a post-COVID world that we're living in, I think that probably everyone on the Zoom here is familiar with what surveillance is. But I wanted to stress some key words from the CDC definitions around public health surveillance. So specifically, you can see here that surveillance should be an ongoing system, so not only done during a pandemic. And we're not just talking about data collection, but we're talking about data dissemination and sharing as well, and that dissemination should be timely. And then going into the why of why we're doing surveillance, well, of course, we're doing surveillance to use the results of that surveillance, to use the results of the information collected to protect the public's health by informing policy and programs. So just want to make sure that, you know, those sort of definitions stay sort of forefront in people's minds. Next slide. Before we get again into the details of the specific project, I thought it might help us shift gears to pause for some reflection on maybe your personal experiences with public health surveillance. So I've got two questions. First, thinking about the last time that you viewed data on the prevalence of disease in your community. Where did you go for that information? Was it your state health department, the state health department, the Missouri State Health Department? Was it the CDC? If we're thinking about, you know, COVID, maybe it was something like the New York Times or the Johns Hopkins dashboard. Was it your local health department? And then the second question I have here is, have you ever changed your behavior based on disease surveillance data? And the reason I'm asking this is really to stress how important it is that we have access to real-time local information. For most people, I think the answer to the second question is probably yes, whether it was personal choice, you know, I changed my behavior because I saw there was a high incidence of disease in my community, or maybe it was by decree, right? I think nearly all of us have had to change our behaviors in some way because of health surveillance data. But again, for that behavior change to be meaningful, it has to be based on accurate, local, real-time data. So again, I think we all changed the way we did things during this, certainly the peak of COVID. But for the first time, we were doing, you know, based on the CDC's definition, again, this real public health surveillance, not just collecting the data that's required by law, but then sharing it back out daily, even county level information about population health. But you know, we saw things go really quickly back to normal, and especially in the last year or so, and we've really lost, I think, that ability to look as a nation at a lot of this real-time data. Now, thankfully, some public health departments used COVID as this opportunity. I think there are lots of opportunities as part of it, but to rethink how they did surveillance. And we'll get to that in a minute. But first, I wanted to provide just a quick overview of sort of what the typical scenario is currently when we're talking about public health data, and particularly public health data in Missouri. So public health departments are awash in data, right? They get a fax every time a local physician or hospital has a case of hepatitis. They're notified about every reportable STD, every case of food poisoning, every animal bite, and they're getting influenza, RSV, and COVID reports still. If you go to the state statute, I think there are over 150 different notifiable diseases and conditions that have to be reported to local health departments and to the state. And with each report, we get information about not just the disease that it's occurring, but the person's age, sex, and sometimes their race and ethnicity, and sometimes personal information for contact tracing. So this is the surveillance, right? But then what happens to this information? In most cases, it's sent on to the state and then to the CDC. And then if we're lucky, we'll be able to see a report on really the burden of each major disease that's, you know, a year or 2 or 3 out of date. So what are our options from getting public health data from the state? So you can see on this screenshot here, the state of Missouri does provide some reports. You can see that there is a weekly communicable disease report, but this is only going to give us numbers for the counts for the entire state. We don't get breakdowns by age. We don't get counties. With flu, we're doing a little better. We can see by region. We can see some trends by week. And for some reason, Jamie, if you'll click once, we do get a monthly, let me do one more time, a monthly county level breakdowns of rabies occurrence in animals. I just posted this image because I can't, honestly, I can't believe someone's responsible for updating a PDF map of rabies in animals every month, and not just shading where it's occurring, but also the type of animal and the counts. Anyway, but we saw it was really better to do, possible to do better with COVID. So, you know, the question is, why aren't more public health departments sharing this data? And really, there's a number of reasons. Working with data is hard, right? We're faced with all of these different challenges. One of the first challenges we've heard about really is around this data fragmentation issues, meaning that data in public health is scattered across different systems. Different systems collect and store data differently, which makes it really difficult to put everything together. There's separate protocols for flu, for STD, for animal bites. And it's not just the reporting systems that are fragmented. There isn't, you know, then this standard set of data governance practices for public health. So each public health department, each county may be doing something differently. And as a result of these different systems, really data isn't standardized. So we have these challenges of achieving standardized data definitions, coding, reporting protocols for the different systems. And without these standardization practices, it really becomes challenging to aggregate data and share it and conduct analysis and make these meaningful comparisons. Data security is also really a big concern when we're talking about public health data, because as we said, we're dealing with sensitive and personally identifiable information. And it's, you know, important, we're mandated to protect individuals' privacy and prevent data breaches by folks getting wind of this information. So balancing this, you know, data use and data sharing with privacy can be a challenge. And of course, we're dealing with very limited resources and capacity when we're talking about public health data and data management. Missouri is one of the worst states when it comes to local public health funding. That means that our public health departments are often, you know, short on staff, or the staff are overworked, and we're just dealing with, you know, working with outdated technology and infrastructure all around. And then all these challenges put together really impact our ability to collect, manage, and per our last bullet point, to share data effectively. So as a result of all these challenges, we're really doing a, you know, not great job of making data-driven decisions when it comes to public health data. But as we saw, these challenges are not insurmountable. Next slide. And that's how this collaboration that we're going to talk about just came about. So really, what happened was we had these great innovations and partnerships that really came out of COVID with this emergent need to track and share COVID incidence data. So we ended up working together to create a number of systems to support data collection and data sharing for public health departments. And really this partnership facilitated this local data sharing pipeline in 2 ways. First, we made innovations in data collection, sort of helping bridge those fragmented data systems. And then secondly, we developed new technology that enabled improvements in data sharing, giving really some of the power to do data sharing directly back to public health departments with these improvements around real-time data sharing, sharing out in different languages, and then sharing within the local public health department websites at very, low costs and low overhead for the health departments. Okay, so first we're going to talk about the data collection improvements. And really, I think this is probably the most important factor to talk about, even though it's maybe more simplistic. So with the systematic data collection process in place, it really just opened this whole world of opportunities for analysis and sharing. Next slide. So what did that improved data collection process look like? Well, again, it really wasn't anything all that sophisticated, but remember at the time we came into these partnerships, some of the public health departments we're working with, they didn't have any really way of internally tracking systematically reportable conditions or disease incidents. So as far as improving data collection goes, what was developed was honestly, it's just an Excel template. And that's all that it took to make this work possible. But it was developed, spearheaded by some folks at the Andrew County Public Health Department, took their initiative to work on this effort, to design a tool that worked for them. And then they were willing to share that out broadly with other departments. And as we've seen, it's working well for these other counties as well. And it's not this complicated thing. It started as an Excel file with about a dozen fields, most of which were set up with data validation rules, such that as you go to enter a new record, the values in each new cell were limited to a set of responses. Jamie, if you click once, you can see, I think, the image change. So yeah, so if you go to enter when they get a fax or a report of a new disease or condition, a staff member goes in and adds a record to a master sheet. And many of these fields are dropped down, so they can input the age and a range, the disease from a drop down, whether if it's a case of hepatitis, I think it's chronic or acute, with the thing was faxed in or called in. And then we have a status in terms of the I think it's a probable or a confirmed case. But really this simple file made it possible for health department staffs to compile and store their data all in one place. And as you'll see very soon, to then share it back out with others. And in terms of data security and data storage, while initially we were working with an Excel file, some groups have transformed or moved the Excel format to use protected Google Sheets. Some are using, I think, Microsoft Teams files, and this template works with all of the above options. Next slide. Okay, so now we've got to this point where our data is being collected and standardized, but then the question was, how do we share it back out with decision makers and with the public, especially thinking about some of those issues with data security and privacy, things being tracked like patient names, addresses in some cases. And then in addition to data security, we're also talking about, again, our underfunded public health departments with limited resources and maybe limited technical capacity. So with COVID, what we did at CARES was develop some technologies to make data sharing and data transfer much more efficient. And we were initially funded by MU Extension to sort of help with the initial technology setup costs. So the overhead was initially basically zero in terms of what it took for our public health departments to utilize this infrastructure. Next slide. So again, remember that we're talking about, in the cases of the groups that we're working with, these mostly rural county public health departments with very, very limited staff bandwidth and limited computing infrastructure. But with COVID, it was vitally important that all counties be able to share their case numbers really on a daily basis. So again, with some startup funding from MU Extension, we developed a handful of procedures that would enable data transfer of the relevant data fields directly from these standardized templates developed by Andrew County and others to our CARES databases. And we're continuing to use those procedures today with our other public health dashboards. So in a matter of about 30 minutes of working with public health staff, we can set up a program that basically what it does is it triggers a nightly or a weekly transfer of data from this standardized reportable disease tracking sheet to our CARES database. And this works with different kinds of files, like I said, whether it's a file locally saved on an individual's desktop computer, if it's a Google Sheet, or if it's a Microsoft Teams file, or if it's a file with some security or protections around it. Next slide. So what we do is we share our code first, initially over email with our local public health department staff, and then we schedule a time where we can screen share to walk through the process of setting up the program. And once it's set up and tested, unless the file is moved or altered or transferred, the data continues to be sent from the local public health tracking sheet to our databases on a weekly or a daily basis, depending on the frequency requested. So what that means is we can get weekly data on the incidence of all notifiable diseases in the counties that are working with us, not just flu and COVID. And this flow chart sort of shows the process of how the application works. So starting with the reportable disease tracking file, wherever it is, if it's a Google sheet or a local file, we then have this app script or Windows PowerShell program triggered to run weekly or daily, which basically sends that Excel sheet to a CARES data upload API, which then transfers the data to the CARES database, which then triggers a database procedure and essentially updates a website or web content then in real time. So after this initial setup from both the local public health side and the CARES side, we have very, very limited need for interaction or engagement after that. Things just tend to work. Now, occasionally we'll have to troubleshoot if an upload fails or something because the computer was turned off during the time the job was scheduled. But we were working with, I think, 7 counties during COVID, and we currently have 4 public health departments and really have had to troubleshoot, maybe a dozen times in the last year. And that tends to be a quick 2 email exchange to fix a problem. Okay, so that's the process. Now, at this point in the presentation, we've sort of explained how the data gets to our databases. If you go to the next slide, we can see what the result is. So thanks to our, I guess 30-year history of CARES and working with different groups to make data accessible, make data interactive and shareable, we have been really able to just quickly modify some of our existing reporting tools to support the display of this new information. So I didn't think we had time to go to our live sites today, but I wanted to be able to share the results with you, what this looks like on our public health dashboard. So as I mentioned, we have working dashboards for, I think, 4 Missouri counties, and we'll hopefully be able to bring a few more on this year. But the first thing to note is that these data or the product really is delivered to each county health department as a widget, which can be embedded directly into the local public health website. So here you've got a screenshot really of the Andrew County Health Department web page with this reportable disease dashboard embedded directly into their site. So for each reportable disease or condition, you have the option to show the incidence in the last 6 months or in the last year. There's this little time period toggle, and the table provides both the count and then this quick comparison to the previous time period. So you can see for each record listed with any incidents, you can see if the trend is increasing or decreasing or stable. I think click Jamie. So then you can also see the data drilled down for a specific reportable disease. You can view the data by condition category and drill down to visuals that display whether it's a more granular trend over time, by month, or data visualizations to show maybe age comparisons or the breakouts by gender. And then if you see on the top of this little image, the read more about animal bites, there are links for each disease or condition to a CDC resource for further information, or in some cases, I think it's a state of Missouri resource. And then we do also have a short section with frequently asked questions. Click. And so those were developed in collaboration with Andrew County, and we've iterated over the FAQs a few times with other groups to sort of best suit the language that they wanted to have associated with their dashboard. One more click. Okay, thanks. So another ways that we're improving data sharing and extending the reach of this data is by supporting Spanish language translations for the web content. And this goes beyond Google Translate. We actually have a Spanish speaking staff member who's translated all of the content, including the FAQs, the disease names, et cetera, to get the most appropriate and accurate language for each sentence and table label. And the language toggle is available by default as part of the embeddable dashboard. So whenever it's embedded into a new public health department website, you have that ability to toggle back and forth between English and Spanish. Okay, so to date, we have, again, public health surveillance dashboards with 4 county health departments. And so those are Andrew, Cass, Carter, and Harrison. We've had inquiries from a few others, and we just got an email earlier this week from some folks who reached out because they had heard that there was great community response to the dashboard, which is really just fantastic to hear, because that's really the whole purpose of these dashboards, is getting this information in front of the public and the decision makers. And while it's great that these dashboards all use the same template and are really moving Missouri public health forward in terms of organizing and using the data to inform population health, we've been able to leverage, again, the same technology to do other things. So one of our partners, CARES partners in Rochester County, New York, got wind of these dashboards and asked if we could do something similar, but just for flu and RSV. And so we worked with them over really just a couple of weeks in terms of like new development time to stand up a dashboard to let them see their flu data and RSV data in real time. And this was a huge time saver on their side, because previously an analyst was preparing, weekly Excel files and putting them into PDF documents and then emailing them out. Well, now their data updates in real time, so it has this wider reach as they can share it over email, social media, and more. And really, we hope to continue to leverage these tools to work with other groups. And our goal, I think, is to bring another, handful of public health departments in Missouri online in the next couple of years, or next year, and then to continue to spread the word to other states as well. All right. So we talked a little bit earlier about some of the barriers to local data collection and sharing. And I know we had the poll at the beginning to have folks indicate sort of where they were on the process. And I'm not sure what barriers you all face, but one of the big concerns with making the public health data actionable really is this topic of data security. Again, public health departments collect information that includes personally identifiable information, because epidemiology, sort of demands it. We need, to be able to do contact tracing for infectious disease, for example. But really, it's essential, obviously, that information stay protected. And on the other side of that equation, the University of Missouri takes data security very seriously. It requires these extreme levels of security in our machines, computers that house any personally identifiable information. We at CARES don't have those servers. So part of this collaboration really was around identifying these solutions for data security that didn't require huge investments in IT infrastructure and could work with the technology that public health departments already had access to. And we really feel like we're doing that through this process by protecting that information such that it never even, is sent over the web. It never hits our servers. All we get are counts of incidents by county. We don't ever, transfer a name or any personally identifiable information over the servers. And we're even going further by providing some data suppression on top of that, such that in our breakdown charts, as you may have seen on my image, I think I forgot to mention, we're not showing any data where the counts are less than 3. Yeah. And then one other topic I wanted to make sure to just call out again is click, Jamie, is around data equity and equitable access to data. So we really feel that this whole effort in part touches on this issue of equitable access, because it's putting this data in the public realm and at very, very low costs, just sort of this cost for our staff time to initially stand up the dashboard, and the additional, maybe staffing costs for public health departments to start this process of collecting the data. So again, this work is overcoming that additional barrier to data sharing by making it possible, particularly in our underfunded public health departments, to do data sharing. Again, before this information was accessible, but only after a media request or sometimes a FOIA request, or after it was aggregated to state or national levels. And really, when we're talking about the public health department's data, never in this standardized or comparable way in many cases. So now that it's available and at further levels of granularity and more timely than before, it really improves on this equitable access to data. And I think our work around translations, moves us further in this direction as well, although we'd like to go further by providing additional languages in the future. Yeah, so that's the presentation today. We can go back to, I know there's been a lot of chat in the chat there, so we'll pause there and see what's happened.
Thank you so much. We have had some questions in the chat, and I'm not sure, some people can stay for this last half hour and some people can't, so I'm not sure who's still here. And if there's anyone who posed a question who would like to share it, Sal has raised your hand. Go ahead.
Great presentations. I mean, this is awesome. And you all saw my comments on the website, obviously. I am concerned at the very front end with the data collection. And I won't elaborate on my comments, but I'm saying, is there still an opportunity to include language and ethnicity in the data collection? We have an organization. Our partners are the Opioid Response Network, Central Region, the Addiction Technology Transfer Center, the Addiction Policy Forum out of Washington, D.C., and of course local support. We've got zero budget. We have a zero budget. So, but it came up from a question that we had because of the opioid crisis in our Muslim communities and our Bosnian communities and other communities that do not show up in the data. So what we're advocating for is both quantitative and qualitative data. In fact, we've got an event coming up August 1st at the International Institute, but it's still concerning that through the system. So what are the implications of if that data is missing at the front end or not being collected? Well, as you see, as you saw in my comments, well, the data drives research, the research drives policy, policy drives programs and funding. So I think we need to continue our discussion on what inclusive data collection means, because it seriously has implications for now and future. So anyways, so I guess my question is that still possible, Angela?
Yeah, that's a really great question. And honestly, I don't know that I can answer whether it's possible on a uniform basis. I know in the templates that were initially developed for this effort, race, ethnicity, and language were not fields that were included in the initial data collection template. Again, we're dealing with, as we mentioned, fragmented data systems. And I'm not sure if that information is reported universally on when health departments receive data. So that's, yeah, so we're really working, I mean, we need to go back to the origins of where this information comes from to even be able to systematically do that. Now, I know, it's probably available in some cases, not in others. So even having an option to report that will help us uncover data gaps. And that's, sort of tying back to what Jamie was talking about. What this broadband effort did was uncover where the gaps were in the data that was being provided publicly previously. So that may be a great starting place. And I can
Well,
take that back to our next. Yeah.
Let's do it in Missouri, but here's the thing. Our partners, the Addiction Policy Forum, in collaboration with the CDC team, our partners, the CDC, basically did a national search for language materials for this opioid crisis. Guess what they found? 0 on Bosnian. So we've developed, in partnership with them, a response that includes print material, social media, video in English and 12 other languages. And so it's systemic. It's not just Missouri. It's not just St. Louis. This is national. So these materials that were developed are being shared nationally. So if we can do it, I think we'd be a better community by looking at it and acting on it, but it is systemic. This is not an accusation or a negative thing. It's the realization, the awareness that these issues exist with deep implications for everything that we do in every in multiple, from workforce development to healthcare and places in between. So anyway, appreciate the presentations.
Yeah, those are great comments, and obviously something I think should be in the forefront of our, minds when we're moving forward with our next conversation. So thank you.
Yeah, and I'll just say real quickly, we've done some work in the past and still do with the opioid epidemic and collecting data around opioids. So if you've got any interest in doing more local data collection, we've had many ideas about how we can, look at EMS data and, other types of, reported data from our service providers and stuff around the state to get a better picture of what's going on in a more real-time way, but haven't quite been able to act on it yet. So let us know.
Yeah, I'm glad you all are able to connect. Somebody else had their hand raised. Dawn?
Okay, thank you. A great presentation, and just exemplifies all the opportunities that today's information technology presents to us, both challenges and opportunities. But, we have this incredible disconnect between the research, the outcomes, and public policy. The comment earlier about the underfunding of public health in Missouri is an Achilles heel. So all the data, is gathering, is not being. We're not getting the return on investment that we should. So we're going to have to do a lot better job of connecting and educating from the health literacy of our policymakers. Because data, IT is cheap these days. And so for relatively small expenditures, we can have a tremendous impact. So that's a comment as well as a question to anybody else that has those thoughts.
Yeah, I think that's a great point. And part of the reason why I'm really hopeful we can bring more counties on board with this process is right now we've got just a small scattering of counties who are participating. It would be great if we could put more data together to really look at regional trends and maybe why things are happening in one county that aren't happening in another county. What's a policy that's in place that's being protective or is posing additional risk in certain areas, and some of that can be done right with what the state is getting, but like you said, I think providing access and more opportunities for additional folks to be able to do that sort of research is hopefully where we're heading. And not that CARES has to be a part of it, really. It is part of this. The data collection and standardization is so important to being able to move forward with this that I think we're taking baby steps. We're getting there.
Thank you for that question. And I want to point out there's a question in the chat. Also, Scott has his hand raised. So if you want to give your question, and then after that, I would love, I think it was Andrea asked a question about how you had such success with QR codes, because maybe Andrea had a little bit less experience and wants to know if you have any tips. So go ahead, Scott.
Yeah, hi, thank you. So I just want to, so I'm the new director at the Cooper County Public Health Center in Boonville. And prior to that, I've worked with the state for over 24 years, their health department, and then also with the Columbia-Boone County Health Department and the Kansas City Health Department. And I just wanted to comment on what Don said. I agree with you 100%. I can assure you that we have been working for decades to try to increase the health literacy of our policymakers everywhere, you know, from the local level through the federal level. And the point where we're at right now is that they don't always want to hear that from the public health department. They want to hear that from folks like you who are not necessarily in public health, but who nonetheless have the credentials and frankly, that they trust, because there's a lot of policymakers right now that do not trust public health. I'm just being blunt, because I think that Don is absolutely correct. And we're just to the point now where I would just appeal to all of you on this call who are not necessarily in the public health as intimately as what I am. I mean, we will continue to do that, obviously. But it's been our experience that policymakers listen a whole lot more to other people about public health than they do public health practitioners. So just wanted to throw that out there and add to what Don said. And thank you for this presentation. And Angela, we really look forward to working with you.
Great. Thank you so much for joining, Scott. I appreciate your comments as well. And that's really great to hear. Yeah, looking forward to working with you. Okay.
Yeah, I saw the question about QR codes, and you know, I think the great thing about those is that, you know, you can make them for free, and they can be big or small. And really, I think our success with the QR codes was like any possible place that you could stick a QR code, they were sticking QR codes, you know. So especially for the in-person events, one of the things that we did is we obviously set aside time for participants that were part of the forums to take the survey and to do the speed tests and things like that, you know, from while we were with folks. We also, like I said, the other really great strategy that seemed to be very successful was partnering with the local governments to get the QR codes on the utility and the tax bills, since that literally reached, like the tax bills kind of reached everybody, the utility bills reached quite a few folks, and they did it more than once. So it was sort of a repetition thing, right, too, that it wasn't just seen once, people saw it again and again and thought, well, maybe I should do this. I think the other big piece of it was making sure that we were making the case along with the QR code, why this is so important. And for the broadband effort, you know, we had a direct case to say, if you don't do this, we won't have the data to get the money or to make the plans that we need to make, you know. And so that really did help, you know, encourage people to go online and to do that speed test and to provide information for the household survey. So I think those were, you know, some of the better ways to use it. But yeah, I think for the most part, basically just anywhere we could stick one of those codes, we did it.
And I know we have limited time left, but I did want to also open it up to this larger question that was posed earlier after in the presentation and after the initial poll, which is for those who are doing any kind of data sharing or data collaboration. What are some of the challenges or benefits that you are seeing from your efforts? So I know we heard some things here about like challenges of some people just not being willing to share their data, and how do you work around that, or data being incomplete. I really appreciated that broadband example as someone who used to live in a rural area, having no broadband access, but all of the maps said that I did. That's very frustrating. You know, some of the different challenges that you all mentioned about, you know, what kind of data are you collecting and how can you work across you know, counties and organizations. So I just wanted to open it up to other folks to weigh in on any challenges or benefits of data sharing efforts that you've done. These resonate? Do you have different ones that come up for you? I saw that Chris had put some things in the chat about COVID and, you know, frustrations with the ways that COVID data has been reported. I think we've all experienced that.
I really love the comment about the tree canopy too. The folks that are out there, you know, that's a on the ground sort of data collection strategy for the most part, but we've got a team member who's also thinking about how to do that with drones to see tree canopy and sort of density and those kinds of things too. So that's exciting as well.
Yeah, very cool. I don't know if that person is still here or not. And Chris said in the chat further about the COVID question, what are the best ways to access data on COVID, given that it continues to be a public health concern? And yeah, do we have a good sense of what data is available and reliable on COVID? I don't know. I'm not an expert in that.
Yeah,
but
I wish I could answer a little further. Maybe some of the folks who are working in public health departments have a better answer to that. But I know we are still on the dashboards that we are supporting, still reporting line items for COVID versus RSV versus flu. So I don't know if it's officially on the list of notifiable diseases in Missouri. I feel like it is, but I'm not sure if that was just for the duration of the emergency or not. So it is still coming into us. There are still national sources of information, but not at the level of granularity we were seeing earlier in the early 2020s. So yeah, it's just a shame because we're seeing, you know, some upticks, you know, now we're about to enter another flu season. Is this just going to be bundled as a respiratory disease where we can, you know, look at it with other line items? I'm not sure what the future direction is. But it seems to me like it should be a separate, you know, we should be able to tease out differences because it impacts different populations differently. So I don't have the best answer for that, but I'm glad that it's being posed as a question still.
Yeah, I mean, my understanding is that like the CDC, I think, is not posting raw numbers. I think they're like posting like rates of change potentially. I mean, we know that a lot of like the case surveillance will not be around because people aren't testing that much. But yeah, as far as I can see, like the WHO data in terms of like weekly deaths, just kind of at a precipitous drop off in March of 2023, and it just goes to zero. So trying to figure out like, is there anywhere we can, because like in addition to like COVID itself being a concern, I mean, you could think about the impact of long COVID, which is not very well understood. And that will be hard to pin down, especially if, you know, someone got asymptomatic COVID that triggered this, or they did get COVID, or, you know, it's not being recorded. Like, I don't know, I'm assuming like it might still be recorded in death certificates, but that certainly doesn't seem to be available to the public anymore.
Yeah, and if we learned one thing from the opioid epidemic is that you can't really always rely on what the death certificates say either. You know, they sometimes they take their best guess. Sometimes they write down what the family wants you to write down. So yeah, so I think that makes it more challenging as well.
Any other questions for our presenters or any other challenges or comments about your own data sharing?
I've got just one comment or question, is how, because the quantitative data can and does leave gaps. So how do we incorporate qualitative data? Because I could take you to communities where, for example, opioids is just devastating their children. And they can tell you the stories, like the death certificates, the impact of stigma, the impact of mental health, the impact of everything. But how do you, is there a middle ground? Can we, how do we close the Venn diagram if those are two pieces of data? How can we bring them together? I don't have an answer, but it's interesting to think about it.
Yeah, I agree. And I think we've been asking that question now for probably too long without an answer, is how do we really do a good job of bringing both of those together and in a way that's not overwhelming and that's meaningful and comparable. So yes, let's all keep thinking about solutions for that, because it's got to happen in some way.
Yeah, and in part, that's sort of where these partnerships become so important. And while, you know, I think some of our team have sort of the expertise in data collection, data sharing, we really need those partnerships with the local groups who are in the communities and hearing those stories to help to allow us to share them, whether it's in combination with the data or if it's, you know, story first and data support, more of a supporting role. It's really the collaborations and partnerships that allow us to marry both of those things together. And like Jamie said, I don't know that we've ever done it perfectly yet, but we're getting there.
Well, I just want to thank you all again. Oh, you have one more question? Go on ahead, Don.
Yeah, I would just say, I think, again, follow up on Sal's comment, it underscores the importance of having a good public health system where you are developing strategies that address not just individuals, but households. Other countries are doing these things and doing the data much better than we are. And some of them are third world countries, okay? So, but if we don't have a good, strong public health system, the data is just not going to be put to good use.
All good points and totally agreed. If only the people in this room could solve the systemic problems that are involved here. And we know that they are bigger than us, but that is why we keep, you know, trying to have these conversations. And, you know, some of your questions about how can we think about quantitative and qualitative data together, and, you know, how can we really sort of think about policy? How does this relate to policy? And all of these kinds of things are some of the kind of events that we hope to be moving towards as we move into the next phase. And so each of these data deep dives might be very particular, but hopefully, if you have topics that you're interested in, you can always get in touch, and we will try to, you know, engage a broader set of topics collectively, even though any one event can only cover so much. So thank you for all of your comments. And I just want to, in the chat one more time, put the links for both the survey for this event and also the September event. We hope you will join us. And once again, join me, for those of you who stayed at the end, thank you so much to our presenters, Jamie and Angela, for a great presentation and taking the time. It was great to learn about all of the great stuff that you're doing, and we look forward to, you know, hearing more about it as it develops.
Yeah, thanks so much for having us. We appreciate it.
Thanks, everyone.